investigate these a lot more in later modules. But these curves, you can see the cervical curve moves forward in space, the thoracic curve moves back in space, the lumbar curve moves forward in space. These are essential curves. And so with our stacking, we never want to lose these curves. We want to stack in a way that supports the maintenance of these natural curves of the spine. Okay. So a balanced way of stacking creates optimal length tension relationship for the core muscles to work efficiently. And optimal length tension muscle relationship is when a muscle is in resting position without excess tension and without excess length. And so positioned this way, a muscle can have maximal contraction and maximal length, maximal relaxation, we should say. So maximal contraction and maximal relaxation. And a way to kind of sense this in your system is if you came to standing right now and gently pushed back on your knees to hyperextend your knees. If you have hyperextension, please be very careful. And just sense how if you attempt to push back to hyperextend your knees, how your quad muscles, the muscles at the front of your thighs, will always be living when you're standing in a place of chronic tension. And so that's not an optimal tension length relationship. And so for someone who chronically hyperextends in the back of their knees, their quad muscles will not be able to access maximal contraction or maximal relaxation. So the bones of the head, the rib cage, and the pelvis are important because they provide the attachment points of the muscles of the core canister, like we've looked at. And when these bones are stacked appropriately, the muscles of the core canister can find their optimal length tension relationship for efficient contraction, both for breath and for movement. So let's look at the valves of the body. The bones these bones that we're talking about are also important because they provide stability for the upregulation or the downregulation of intra-abdominal pressure through what we call the main valves of the body, which are the glottis, the respiratory diaphragm, and the pelvic floor. And so what valves are things that can be adjusted to affect flow. And when these valves are adjusted, they affect pressure within the thoracic cavity and within the abdominal cavity. And so the glottis, which is part of the larynx, if you take a big breath in and you hold it, you have just closed your glottis. And when you release your breath, it is your glottis that opens to allow for the flow of breath. And so the glottis allows air to pass in and out of the trachea when respiratory muscles contract. And then, of course, we also have the respiratory diaphragm and the pelvic floor, which are considered valves. We will keep talking about these valves and looking at these valves when we speak about bandha. And so we'll investigate that a little bit more when we do more breath work together, how we engage bandha. Bandha is a word in yoga that means locks. And so it's the same thing. These are the locks or valves. And of course, when we do, more asana, more posture in later modules, we'll certainly be investigating bandha. And so we come back to this concept of progressive adaptation. And so we really want to practice our breathing when we do breath work and asana and movement in a way that is always strengthening our postural neutral. This will be a big concept we come back to again and again. And what do I mean by that? So let me just give you a tiny example. I'll give you a couple tiny examples. So let's say you're someone who practices a lot of Ashtanga yoga and you do a lot of sun salutation. And so this is a consistent, regular practice for you. And a big part of that practice is plank to chaturanga, right? I'll just show my arms. But what if every time you come down to chaturanga, you round your shoulders deeply and you hook your neck forward and you tighten your serratus muscles to lower down. And that is what you've practiced. You've practiced a lot of flexion in your upper back, a lot of tension in the sides of the body with the neck forward. If you do that again and again and again, we are reinforcing a posture of rounded shoulders and tension within the thoracic area of the rib cage. And so what we want to begin to really dissect is, what are we practicing? What is the force that we're placing on our bodies again and again and again? And then how is that shaping our bodies? Because really essential pose, functional pose is Tadasana. How do we live in postural neutral, especially when we're not thinking about it, when it's unconscious? Okay. Here we come back to this foundational sutra about asana, about posture. Sthira Sukham Asanam. A yoga posture has an equal amount of two opposing qualities of firmness, stability, and ease, meeting an equal measure. Hence the name of this course, The Art of Opposition. We're looking again and again and again to find that at any moment we have both stability, groundedness, support, ease, and openness in our experience. And that is what creates any moment, any pose, any action to be yoga, opposed to anything else. Okay? So, and what we can say is that no matter what, at any moment, there are always these opposing forces happening within us. And if we're just going to talk about our physical body, now it doesn't mean that they're always in balance, of course, but both are always present. Stability and movement, right? Because we're always shape changing, because we're always breathing. And one of the ways you can think about this in terms of how this is applied in the yogic path is about living in the middle. And what I mean about that is that as humans, we tend to move to the extremes. And so there are the people who constitutionally naturally gravitate to working really hard and doing a lot, and also can create an incredible amount of stability, but with that excess rigidity within their systems. And that looks like something which is different than people that live in the opposite extreme, who are more flaccid and don't put in much effort and have a different quality of how they move through the world, right? So those are the two extremes. And in yoga, we're begin to see, who are we? What is our natural tendencies? And how can we begin to adjust to live more in the middle with both stability and ease? So let's talk about the core canister again. So the abdominal core canister is a term, again, that we use to talk about the core muscles of the body, and this includes the respiratory diaphragm, the abdominal muscles, some of the muscles of the back, and the pelvic floor. And we often hear of it as the respiratory diaphragm is the lid of the canister. The transverse abdominis, so that deep abdominal layer, is often considered the front and the walls of the canister, but really all the abdominal muscles work together. So you have transverse abdominis, you have the rectus abdominis here in the front, you have the two layers of the obliques. Here's the internal oblique in the fuchsia pink, the external in the purple, and they're all attaching to connective tissue. Okay. And then we have in the back of the body, we have these deep, deep intrinsic core muscles called the multifidus. And it's considered to be one muscle, even though they're tiny little stretches of muscles that all work together to create spinal support. And then layered on top, so more superficial to the multifidus muscles, are the erector muscles. There are 3 on each side, and also create spinal support and are part of extension. So if you go into a back bend, these muscles really engage. So that's the back of the canister. And the base of the canister, again, is the pelvic floor and pelvic diaphragm.